The Cold Rush Cold Therapy System is designed for single-patient use only. Use of the Cold Rush Cold Therapy System is designed to reduce localized pain and swelling following surgical procedures or trauma. Warning: the Cold Rush Cold Therapy System can be cold enough to seriously injure skin. Read the instructions, which are located inside the unit, the instructions for the pad, and the labels on the device carefully before operating the Cold Rush Cold Therapy System. Warning: skin inspection and adverse reactions. The patient or his healthcare provider must check the skin at least every 1 to 2 hours during use of this device, regardless of whether the patient is asleep or awake. Contact your healthcare provider immediately and discontinue the use of your Cold Rush Cold Therapy unit if you experience any adverse reaction to the treatment area, such as increase in pain, burning, blistering, itching, increased swelling, discoloration of the skin, increased redness, welts, or any other changes in the appearance of the skin. The unit is not suitable for use in the presence of flammable anesthetic mixture with air, oxygen, or nitrous oxide. Do not operate where aerosol spray products are being used or where oxygen is being administered. Warning: use only Össur Cold Rush pads. Alternative brand cold therapy pads should not be used with the Cold Rush Cold Therapy device, as the temperature may become too cold when using alternative brand pads. To create the safest operating conditions possible, Össur has designed the Cold Rush Cold Therapy System to operate on a 12-volt power supply, significantly reducing the chance of dangerous electric shock. Great care should always be taken when using electricity near water. Unplug the unit before filling it with ice and water. To avoid danger of electric shock, be certain that hands are dry before inserting or removing the power supply from the wall socket. Avoid getting water or ice on the flow control panel or power adapter. Always unplug this product immediately after each use. Do not use while bathing. Do not place or store the product where it can fall or be pulled into a tub or sink. Do not place in or drop into water or other liquid. Do not reach for a product that has fallen into water. Unplug immediately. Never operate this product if it has a damaged electrical cord or plug, if it is not working properly, if it has been dropped or damaged, or dropped into water. Return the product to your healthcare provider for examination and repair. Keep the cord away from heated surfaces. If you experience disturbance in any other electrical equipment near the Cold Rush unit, please try to unplug it from the wall socket to verify that it is not the source of the disturbance. The device should only be used with a prescription from a physician that includes the following treatment information: the duration of the entire cold therapy protocol, the length of individual cold therapy sessions, as well as the length of breaks from cold therapy treatment, setting of the flow control knob, instructions about how to inspect the skin, and frequency of skin checks. Caution: federal law requires this device to be sold by a physician or by the order of a physician. Caution: the Cold Rush Cold Therapy System can be cold enough to seriously injure skin. Read the instructions, which are located inside the unit, the instructions pad, and the labels on the device carefully before operating the Cold Rush Cold Therapy System. The following patients should always turn the flow control knob counterclockwise to the number 1 setting when using cold therapy. Patients whose treatment area has been desensitized due to local anesthesia or regional nerve blockers. Patients taking prescribed medications that may negatively affect peripheral vascular circulation, including beta-adrenergic blockers and local epinephrine use, such as in local anesthetics. Patients taking prescribed medications that negatively affect their mental capacity or judgment. patients suffering from diabetes, patients who have recently undergone hand, wrist, or foot ankle surgery, patients suffering from cognitive disabilities, young children and the elderly. Care should be taken during prolonged use for children, diabetics, incapacitated patients, and those with decreased skin sensitivity or poor circulation. A licensed healthcare practitioner must determine the correct frequency and duration of treatment for each patient. Review instructions for use with the practitioner prior to operating the device. The healthcare practitioner must monitor the patient's use of the device to assure appropriate use and proper application of cold therapy, including but not limited to application of an insulation barrier between the patient's skin and the cold rush pad. Read the treatment warning protocol instructions carefully before operating the cold rush cold therapy system. Warning: no direct contact with the skin. An insulation barrier is required. Note that it is not included. The cold rush pad should never make direct contact with the skin. An insulation barrier between the pad and the skin should be used at all times without exception in accordance with instruction from the physician, so as to prevent the skin from becoming too cold. The cold rush pad operating temperature is too cold to be placed directly on the skin. Make sure that the insulation barrier is dry. Ensure the cold therapy unit is turned off. Turn the flow control knob counterclockwise to the off position. Do not plug it into the wall socket. Fill the reservoir with water to the indicated fill line. Add chopped or cubed ice to the reservoir up to the indicated fill line. Attach the provided 12-volt power supply to the DC power port. Do not plug it into the wall circuit. Ensure the insulation barrier is in place over the skin in the treatment area. The cold rush pad should never be applied directly over your skin. A patient should never utilize cold therapy while asleep or unable to check the skin every 1 to 2 hours, unless specifically instructed to do so by the prescribing healthcare provider. Connect the cold rush pad to the hose extending from the unit. To ensure proper connection, push couplings together until they snap into place. Never drop or insert any object into any opening or hose. Do not attempt to drag or reposition the cold rush cold therapy unit by pulling or tugging on the insulated hoses, as this may cause damage to the unit and/or cause the hoses to disconnect. Use the handle when moving the cold rush cold therapy unit. Plug the provided 12-volt power supply to the wall socket, 120 volts US, 240 volts Europe. The product should never be left unattended when plugged in. Other than for the conditions noted earlier, for which the knob should be set to number 1, turn the flow control knob clockwise to the number 3 setting. This will turn the unit on. Wait 10 minutes to allow the temperature to stabilize before adjusting the temperature for comfort. Turn the flow control knob clockwise to decrease the temperature. Turn the flow control knob counterclockwise to increase the temperature. The flow control knob should never be set at the maximum settings, number 4 or max, for more than 30 minutes. Check your skin every 1 to 2 hours once a steady flow of water through the pad is achieved. To To turn the cold therapy unit off, turn the flow control knob counterclockwise until it stops. Always turn the cold therapy unit off before disconnecting the cold rush pad or any hoses. To disconnect the hoses, press the release tabs on the coupling and pull the connectors apart. Drain all of the water out of the cold therapy unit after each use. Follow the directions in steps 2 through 10 in the Instructions for Use booklet before each use. Troubleshooting tips. The pump will not turn on. Ensure that the power supply connector is properly inserted into the port on the unit and that the wall plug has power. The pad will not get cold. Visually inspect the pad to see if water is flowing. If water is flowing, check the pad for pockets of trapped air. Lower the pad below the unit and gently massage the pad to help remove the trapped air. Once water flow appears to move freely through the pad, resume usage. If no water is flowing, make certain the unit is properly filled. Refer to the filling instructions in the Instructions for Use booklet. Check the hose connection to ensure that the coupling is fully engaged. Check to ensure that the hose is not kinked or pinched by any object. Water is leaking at the connector. Unplug the device, disconnect the hose, visually inspect to ensure the coupling connectors are in the open position, and then reconnect the hose. A snap or clicking sound indicates proper connection. The pad is leaking. Remove the pad, towel dry, and then visually inspect the pad. If a leak is detected, then the pad will need to be replaced. See the warranty regarding pad replacement. The unit is leaking. With the unit unplugged, visually inspect to determine the location of the leak. Refer to the limited warranty for damaged replacement requirements. If no leak is detected, it may be condensation. Do not try to repair your cold rush unit, as this may create a user hazard and will automatically void warranty. After talking with your healthcare provider to ensure you are following the operating instructions properly, the unit shall be sent to Össur for repairs or maintenance. No other company or individual is allowed to service or repair the unit in any way. When you have finished all of your cold therapy treatments, prior to prolonged storage, fill the unit with 1 gallon of water, or enough so that the water level is at the ice fill line. Add 2 tablespoons of liquid bleach or 3 ounces of 3% hydrogenated peroxide to the water and mix. Connect hoses to the cold rush pad and turn the unit on to the max setting. Allow the water mixture to circulate for 5 minutes. Turn the unit off and unplug the power supply. Carefully drain the water mixture out of the unit and store in a cool, dark place, leaving the lid slightly open. Exposure to sunlight and extreme heat may damage the hose and unit. When reusing the unit after storage, fill the reservoir with clean water and turn the pump on to circulate the water through the hoses and flush the remaining water mixture out of the system. Use the old pad for this procedure and discard the pad after cleaning is completed. Dispose water and refill the reservoir with fresh ice and water combination to begin the cold therapy treatment. Follow operating instructions 2 through 10 in the Instructions for Use before each use. Before you use the unit, inspect the hoses and new pad for any tears or breaks. Contact your healthcare provider to obtain a new cold rush pad. Clean or replace the insulation barrier as recommended by your healthcare practitioner. Follow local ordinances or regulations for proper disposal of the device, accessories, and packaging.